Hey, good morning everyone. Welcome back to my YouTube channel. So in this video, we just discuss history taking assignment. Okay. So how you can take history of the patient. Okay. If you are going first time clinical duty. Okay. So this is the most important topic. How to take history of the patient because that can help to assess the patient condition and formulate nursing diagnosis, right? And also help to which kind of procedure you have to done in a particular patient, right? So start the video how you can take history of the patient. Okay, so first, why you have to take history of the patient. Okay, so history taking is an essential part of patient assessment in nursing practice. It involves collecting detailed information about the patient health status, past medical history, lifestyle, and family background. The purpose of history taking is to identify the patient health problem, understand their needs, and plan appropriate nursing care. Okay, so this is the basic things you have to learn why you have to take history of the patient, right? So this is the format is different according to the college, but according to my college this is the format. Okay, so first identification data of the patient. Okay, so first we have to write patient's name, age, sex, mother tongue, marital status, educational status, occupation, monthly income, residential address. Okay, hospital's name, एंड देन फाइल नंबर, सोर्स प्रोवाइडिंग हिस्ट्री, कौन ना बता रहा है पेशेंट के बारे में, मे बी पेशेंट खुद हो सकता है या उसका पेरेंट हो सकता है, राइट? डेट एंड टाइम ऑफ एडमिशन, व्हेन माय पेशेंट इज एडमिटेड इन आवर हॉस्पिटल. ओके, एंड देन ओपीडी नंबर, IP number, and ward and bed number. Okay, this is the basic things. And then provisional diagnosis. Okay, there are mainly two diagnoses. Okay, according to the chief complaint, if patient is coming into our hospital, that time patient says some problem. Okay, so this is the chief complaint. Okay, according to the chief complaint we decide patient having like this kind of disease or this kind of symptoms. Okay, so that time you just write diagnosis, and this is known as provisional diagnosis. Okay, after the investigation you have to check. Okay, laboratory report and biochemistry report, urine, stool examination, and other x-ray, ultrasound, other things. Okay, so after that we conclude final which kind of disease patient suffering. Okay, so that time you just this diagnosis is known as complete or final diagnosis, but according to the chief complaint you decide this is known as provisional diagnosis. I hope understand what is the difference between provisional diagnosis and final diagnosis. Okay, so then surgery done, if surgery done then you have to write date, okay, and name of surgery, what done to the patient, right? And date of discharge. Mostly if you collect the history of the patient, that time to discharge planning will be not done. Okay, so that time you just write note yet plan discharge. Okay, chief complaint during admission, it means if patient coming into our hospital, that time patient having some complaint. Okay, so this is known as chief complaint. Okay, and then we have to write medical history. In medical history you write past and urgent history. If patient having any disease in past, you just write here. Okay, and present history, if patient is admitted to our hospital. Okay, so this problem will be started from when and till now. All the things we have to write in present history. And first patient is for the treatment, where patient going, like in a local hospital maybe he is going. Okay, and after that you come into the nicknames. Okay, so all the things we have to write in present history. ओके, कुल मिला के पेशेंट जब ये प्रॉब्लम स्टार्ट हुआ, कहाँ पे इलाज कराया, उसके बाद कैसे निग्रीम्स में आया, पूरा कहानी अच्छे से प्रेजेंट हिस्ट्री में लिखना है. ओके, एंड देन सर्जिकल हिस्ट्री, पास्ट हिस्ट्री एंड प्रेजेंट हिस्ट्री. ओके, पास्ट if patient having any surgery you have to write here, and present history if any surgery done in our hospital or in other hospital you have to write. Okay, in present history. Okay, so now next portion is family history. Okay, this is very basic but most important. Okay, so family tree, how you can draw the family tree, you just I show you how you can draw. Okay, suppose my patient having parents and one brother and sister, then how to draw family tree. Okay, So this is for male. Okay, so this is, and if you joined the male and female, this is a married status. Okay, so parent you have to draw like this. Okay, and then my patient is a male, and then having one brother and one sister. Okay, so like you draw. Okay, so this is the family tree. Okay, and you just write like this is for male and this is for female. Okay, and my patient is this, so we just indicate like through arrow. Okay, so this is the family tree. You can draw like that. If patient maybe like uh, father will die, so you just cross here. Okay, so this means father will die. Okay, so this is the basic things. I hope you just learn and draw the family tree. Okay, so now we discussed how to write family profile. Okay, for a family profile you just write like name of the family members, relationship with patient like father, mother, brother, sister, like that, age, type of family, education, occupation, monthly income, and marital status, and healthy status means patient relative is healthy or not. You just write. Okay, so this is the basic thing. And then family interpersonal relationship or any family disharmony, you just write my patient having good interpersonal relationship with his family and neighbor. Okay, or healthcare providers. Okay, they can understand and follow our suggestion or advice selected. You just write. Okay, and then we discussed personal history. Okay, for personal history, habit and hygiene, patient having like wake up early in the morning or late in the morning, or patient having some other kind of habits, you just write. And hygiene, patient having maintained their hygienes like brushing. Okay, and daily bath and other kinds of thing. And patient having any allergy or addiction, if patient having any kind of allergy, you just write. Or addiction like smoking, like alcohol, these kinds of things you just write. Okay, according to the patient. Okay, and then nutritional pattern, my patient is non vegetarian or a vegetarian, or my patient taking 3 times or 4 times meal in a day. Mostly my patient take rice, pulse, sabji and fruits, like that you just write. Okay, and elimination pattern, for elimination pattern, my patient discharge urine like 4 5 times, stool 2 times, like that you just write. Okay, and then sleeping pattern, my patient mostly 8 hours sleeping. Okay, and then exercise and rest, my patient not doing exercise honestly, or take proper rest, I hope. Okay, you just write like that. And immunization, my patient having any take vaccine in past, like hepatitis, corona, you just mention. Okay, and then now socio-economic history. In socio-economic history you just write housing, my patient having pakka or kacha house. Ventilation, my patient having a total number of window in her or his home. Okay, you just write. And electricity, my patient having electricity supply by the government, you just write. Or water supply by government or private, you just mention. Okay, so this is the basic things. Now you just write for investigation part. Okay, for investigation you just write 2 3 things, like first like department of pathology, like hemoglobin, platelets, rbc, mcb, mch, like that, all the things you just write. And then a result or a normal value, and significance means remark. If patient hemoglobin is greater than normal value, then you just write high, low. Okay, like that. For other investigation, you just conclude. And also you write department of biochemistry, like urea, creatinine, cholesterol, like that. Okay, this report also you just write. And other investigation you write like ultrasound, CT scan, MRI if done, or any kind of USG ultrasound done, you just write in other investigation. Okay, so this is the and then medication, some medication according to patient. Okay, patient is suffering from like CKD, so which medication is most important, you just write like 2 3 4 medication, dose, route, frequency, action, side effect, and nursing responsibility. Okay, this is the basic things. I know you are in like first semester, so don't know about the medicine. You just search on the Google and then write what is the side effect of this medicine and what can we do as a nurse. So you just write in nurse responsibility. Okay, so in conclusion we just write normal things. The thank you ma'am for giving me chance to taking care of the history of the patient, so that can help to experience new learning, okay, like about the disease or about the patient condition and how you can handle the patient, okay. So these things we shall write in conclusion. I hope you understand my video, how you can take the history of the patient, right? So मिलते हैं अगले वीडियो में, तब तक के लिए हैव अ नाइस डे.